All right, we are recording. We have Leslie Mora on the call with us. Did I say your name right?
Yeah. Yeah.
Yeah.
Yeah, not
And
a hard name.
we've been working with Leslie for probably since last spring,
Mhm.
trying to help her get into the program. And she's a graduate of Francis Tuttle, which is a career tech in Oklahoma. But Leslie, tell me, what was your high school that you went to?
I went to Edmond North High School.
Okay, so she went to Edmond North High School and in partnership with Francis Tuttle, worked
Mhm.
on her CNA.
Mhm.
Now, Leslie, were you able to get your CNA pre-COVID, or were you in the cohort that had to do it this summer?
Yeah, no, I was able to get it pre-COVID since I started Francis Tuttle my junior year in high school. I got my CNA my junior year, and then my senior year I was going to clinicals and all that good stuff for my AUA.
Okay. Now tell me about getting your CNA. Was that a hard experience?
I feel like since it was my first time doing that kind of thing, so going to like a tech school and doing um like my home high school, it was a little challenging at first because it was a lot of work and I didn't really know where to start because it was all new to me. But once I got in the swing of things and I figured out, my work schedule and how I could level my work in for Francis Tuttle and Edmond North, it became really easy, and the teachers at Francis Tuttle like communicate with you really well, so it wasn't hard at all.
That's great. Yeah, Francis Tuttle seems to have a really good program, and
Yeah.
and uh, and it seems like Francis Tuttle has prepared you well for
Hmm.
where you're at because y'all are doing well in the program.
Yeah, no, it definitely did. It definitely helped that my teachers, like two of them that taught me most of my skills, were actual nurses that have worked in the field for a couple of years before they went to teaching. So
Yeah. Okay. So obviously you're at the hospital right now. You're in
yeah.
your scrubs. Where are you at? Are you in a break room?
Yeah, I'm in our locker room.
Okay.
That's like the most quiet place I could find.
Yeah. So
Yeah.
um, tell me about kind of your work schedule, your workload. What does that look like at the moment?
So at the moment, I'm doing Mondays and Tuesdays, just working Mondays and Tuesdays. That way, the rest of the days I can focus on doing my schoolwork and spending some time with my family. I do Monday and Tuesdays. I do 12s, but they did start a new like a schedule for aides for nursing assistants that you could come from 7:30 to 11:30 just to help out because since I am on the COVID floor, it is a little bit busier, and since it is COVID, we don't want to be as exposed. So sometimes they just need a little extra help to get everything into the rooms. But basically, yeah, that's what I'm doing right now. I'm doing my 12s on Monday and Tuesday, and then Wednesdays I'm just doing 4 hours.
Okay. And what kinds of things are you doing during the day?
So I do a lot. I do finger sticks. So basically I check their blood sugar. I help them with their linen if they need it. I take in their food. I do a lot of vital signs. Stuff like that. Just, I just help them with activities of daily living.
Yeah. Tell me about vital signs. What does that look like?
So it's temperature, blood pressure, respirations, SpO2, their oxygen level, and their heart or their pulse. So basically, I just take that, and it's on a monitor since it is a COVID floor. We can't be taking individual. We can't have like our own little monitor with us that we can be using around. So we have the monitor hooked up into the wall. So we use that, and it's pretty easy. It's not too hard. My favorite thing to do mainly is just interact with the patients, just because I feel like they're already on a COVID floor where they're isolated from their family. So I think it's really important that they get that communication, just the sense that you know they can talk to someone if they need it and stuff.
Yeah, I love that. I love that you have a
Hmm.
heart for that. So,
Yeah.
are you having to, I guess you're charting the vital signs, right? So you're
Yeah, so
writing
I
it down.
chart if I do vital signs, I chart if I give them a bath, if they shower, if I change their linen, and anything I do, I chart because if it's not charted, it didn't happen. So, yeah.
When you say chart, or when I say chart, are we talking electronical or are we talking
Hmm.
paper?
So yeah, it's electronical. We do it all in the rooms. That way we can reduce the amount of spread. So I do it all in the rooms, and it's all on computer. There was a day last week where we were short nursing assistants, so I was on my own, but I hadn't had computer access yet. So I just used a pencil and paper, like went
Okay.
old school. But
Okay.
for the most part, it's on computers.
Okay. And you'll get computer access.
Yeah, no, I have it now. Yeah, I've had
Okay.
it.
So you have
Yeah.
computer access, you're able to log into the hospital system. So you're also learning the hospital system, which I think is an important part of nursing as well.
Yes, yeah, definitely. Because it definitely helps to know, who your nurses are, what they do, and stuff like that. That way, and who their doctor is. That way, because the nursing assistant's communication is just as important, to get communication and stuff. So.
So to this point, have you been in a place where you've been able to watch nurses interact with patients very much?
Yes. So, sometimes when I go into the rooms, the nurses will come in later and give them meds and stuff. So I get to see that side of it too. And the nurses on my floor are really helpful. So they'll go in and help us change their linen or bathe them if we need it. But I have gotten to see that part of their side too. I get to see a lot of them like recently we've been doing flu shots. They also get, and since they're COVID, I get to see, what medicine they take and how they do it, all that good stuff. So. It's
Yeah.
definitely interesting, and it's
Yeah.
definitely something I had never seen before. So
Yeah. So, I mean, you're getting to experience things now that you didn't obviously experience with your CNA training.
yeah, it's definitely different than a retirement facility or a nursing home setting. So
Yeah. And how many weeks into your work are you?
I think this is my 4th week. This is
Yeah.
my first week not being on training.
Yeah. So you're fresh and you're already learning a lot.
It definitely
Yeah.
helps to be here 12 hours too, since it's the whole day. So you spend the whole day with these people and you learn a lot.
I bet you're pretty exhausted at the end of a 12-hour shift.
Yeah, sometimes. It just
Yeah.
depends on the type of day I've had. Sometimes
Yeah.
my patients are pretty easy and other times they're needy. It just depends.
Yeah. So let's talk a little bit about the interview process when y'all came to Integris and we all were there together, and then you got to go interview with the different managers. What was that like for you?
Um, so when I first got there and I did my first interview, I felt like I kind of bombed it just because I wasn't very prepared for it. It took me by surprise. So I guess, a job fair, you kind of should be expecting interviews. I don't know what I was expecting, but it
Hmm.
kind of did take me by surprise. But when I interviewed with Rick, which is our manager for our floor, I don't know, I had like a special connection with him, and he was really understanding of our coursework too. He understood that we were in college, and sometimes you can work and sometimes you can't. And so yeah, I had a special connection. He was really easy to talk to, and it was just, yeah, it was kind of like it felt right
Yeah.
to go with
Yeah.
him. And I mean, everyone else that I interviewed with was really sweet too, and talked with you, but you get that gut feeling that you should go with that one person.
So you actually got to be on the floor that you chose.
Yes, I did. Yeah.
That's great.
Hmm.
I'm happy for you for that.
Yeah.
That's
Thank
really,
you.
yeah, yeah.
Yeah.
So I know, so you're in, what courses are you in right now?
I'm doing Intro to Nursing and Principles of Biology.
Yep. And Intro to Nursing is going to be a shorter course, and
Yeah, that's a
Principles
shorter
of Biology
course.
is the full semester.
Yeah, I think the nursing one is 6 weeks and the biology one is a full semester.
Yeah. And you've already gotten through one course.
Yes.
Oh,
Oral communications
yeah.
was a trip, but it was hard, but I got
Yeah.
through it.
It was super hard. I heard that from almost everybody. And so
Yeah, it was definitely something.
we're gonna have to rethink the way we offered that. And so we're learning too.
Right, yeah.
But that was a short course. Do you like the idea of just having a couple of courses at a given time?
I think that works best for me at least, just because I know um, I don't have all of these courses at the same time that I have to be worrying about.
Hmm.
So I think that works best for me. Yeah.
Yeah. How's the Principles of Biology course seems to be going really well. That's a hard course.
Yeah, no, it's going really well, and it is a little hard, and the work is kind of there's a good amount of work, but it's really nice because Dr. Medley communicates with us so much, and she's really easy to get a hold of. we have a group me, so every time we text on there, she gets back to us not like in almost immediately. She's really easy to talk to. So it's definitely an easier course if the teacher is on board with you and communicates with you. So it's definitely good. I've adored Dr. Medley so far. She's
Well,
been really
good.
good.
That's so
Yeah.
good. That's great to hear. Well, anything that you would want to tell people that have helped this program financially?
I could not be more grateful for someone to, I mean, it's just amazing that I get a college experience at the price that I'm paying for. I didn't think I always knew I wanted to go to college, but with my financial situation, I never thought I'd be able to. So I honestly, I could not be more grateful for this opportunity that I got. It's honestly amazing. And when you went to Francis Tuttle to talk to us about it, I honestly, um, didn't think I was gonna do it, but the more I heard about it, the better it sounded. So I was like, I'd be stupid not to. So you know,
Yeah.
it's definitely been something, and I would have never thought I would have done online school, but it's easier if you have the right materials to do it and the right teachers.
Yeah.
So, yeah.
All right, Leslie, thank you so much for
Of
hopping
course.
out here and taking a little bit of your working day.
Yeah.
So,
Thank you. Thank
all
you
right.
so much. All right.
All right.
Have a good
Bye.
one. Bye.